Hi there, I'm Lucy McDonald, physiotherapist. Welcome back to my virtual clinic. Today I'm going to tell you what is causing your sciatica and what you can do about it. But before I do, I hope you've enjoyed the videos so far in my back pain series. So how to sit at your desk, when is back pain an emergency, what you can do yourself at home if you wake up with pain, and exercises that you can do sitting in your chair without even having to get up. So thank you all for your supportive messages. I really appreciate it as ever. I'm so glad that so many of you are finding this useful. So what is sciatica, or what is sciatic pain, and what can you do about it? It can be an excruciating pain, and its name comes from the big nerve that passes over your buttock and runs down the back of your thigh. The nerve originates at multiple levels in the bottom of your back, in the lumbar spine, and then joins together in a big fat nerve that then runs, as I say, down through the buttock muscles, down through the hamstrings, and then splits and provides all the information to your feet and your lower leg. So you can feel sciatic pain anywhere along that pathway. So anywhere from your buttock, down the back of your leg, all the way down into your foot. Now, what causes it? The answer to that is any structure that is along the pathway of the sciatic nerve. But the most common is not the piriformis, as a lot of people think, but it's actually a disc bulge in your lower back that can cause an irritation of the nerves as they come out of your lower back here. So you can see perhaps here, in between each of the discs, in between each of the vertebrae, you can see there's this little hole here where the nerve comes out, and at all these levels comes out and then turns into the sciatic nerve. And you can get, if you get a little bulge or anything that irritates the nerve here, then you can get pain being sent down your leg and get that really nasty, nervy sciatic pain that you may well have. So how do you know what to do with it? Well, the first thing is that you must avoid positions where you're stretching that nerve. Nerves hate being stretched, and it will make your pain worse. And I've seen far too many people in that situation in my career. So the nerve is under most stretch when the leg is straight, the ankle is flexed, and the back is also flexed. So we often do a slump test as physios to test the nerves in the back and the leg, and that is the absolute worst position for the sciatic nerve. So if you think about day-to-day things that you might do that might put you in that position, things like driving in a small cramped car, lying in bed reading a book, or even worse, working on your laptop in bed, sitting slumped on the sofa, those kind of things, they're really bad for the sciatic nerve. So do try to avoid that until the pain reduces. However, the sciatic nerve loves movement, little and often. So little bits of movement throughout the day, bits of walking, as much exercise as you can do that isn't too sore. So it might be that you start with a little bit of movement and you build up from there. But because ultimately most of the time it's coming from the back, strengthening the muscles in the back, strengthening the muscles in the glutes and the rest of the body will be the answer long term. So I hope that's been helpful, and if there's anything else that you'd like to ask me, tomorrow I'm doing a Facebook Live 1:30 p.m. on both Facebook and Instagram. So please do come and join, and invite your family and friends too. And in the meantime, don't forget to press that big red subscribe button. Bye!